Welcome back to the program. So glad that you're still with us because we still have a lot of information we want to talk about with Desert View Hospital and the CEO, Susan Davila.
Thank you.
And Susan, again, you gave us so much information in that first session, but I want to look at, you talked about community assessment. You mentioned that you wanted to tell us more about that.
I do, and this is to our community. Every 3 years, as a critical access hospital, which we talked about earlier, we have to do this assessment. I think it's a great tool, Tom. Why do I think so? We need that feedback from our community.
Okay.
So the John Packham from the School of Medicine, Office of Rural Health, he does this for us and has done a fantastic job.
Okay.
And he gathers all the information. We do surveys. The surveys are out. I would ask that any of you that have service organizations that would like to get involved in it, you can do it online, but we have paper ones. They can get a hold of that number at the bottom of their screen.
Okay.
And Mandrell can help them with getting as many surveys as they want. It is important to us because A, we are looking for the feedback from our community. What do they want? What do they want from Desert View Hospital as far as services, education, whatever it might be? And then with John and his team, they put all kinds of stats together for us. And so we can look at age, the different ages, the groups that we're serving, all kinds of things, Tom. And it's so important for us to have that information. So I just really, really encourage our community to become involved in that. And then when John has all of the information gathered up, he puts a nice presentation on. We will do another community meeting.
Okay.
And he will present that. And then what happens with that, it can't just sit in our closet. We actually have to come up with an action plan.
Great, okay.
And then it's posted on our website. And so it's always there for the public to see and see where we're coming at with our action plan on the items.
Okay, now in the surveys, when were they handed out, or how does people get them, other than calling Mandrell at the number?
It is on our website. They can go on our website and it should be posted there. Otherwise, they do have to get the paper ones from Mandrell. We had our first community meeting, which
Okay.
you attended. And so the information was given out there. And then again, we'll get them out. Whatever service clubs that want them, call us. We'll deliver them. But otherwise, it's on our website.
I'm going to bring up something that you and I have not talked about, and that's community outreach. They have a community outreach meeting the second Wednesday every month from 11:30 until 1. I think if you came there, or if Mandrell came there and had those surveys, that could be a fantastic way of getting them out to the community.
I like that idea, Tom. And for those of you who don't know, Mandrell is my assistant, so she does great work for me, and that's, we keep referring to poor Mandrell, and they don't even know who Mandrell is.
That's
she's
okay.
my right-hand gal.
Okay. Again, community outreach meets at the Methodist Church.
Okay.
They have moved from, they used to be at Oasis, and now they're at the Methodist Church. And it is the second Wednesday every month.
Okay.
From 11:30 until 1. If you come at 11, you can get lunch. So,
Ooh.
so I'm usually there at 11. You can get lunch later, but it's always good to be there, socialize before the meeting actually begins.
Well, we'll be there. One of us will be there because that's important to us to get that
Okay.
information out.
And
yeah.
that way, yeah, everybody there, they either heads up another organization, so they might want extras to take to their organizations.
Sure. Yep.
The survey is obviously important. I know it's something we did some years back for the town of Pahrump, working with the county of Nye, and did a community assessment. So same thing, to find out exactly what's needed. And
That's
for our
important.
hospital, it's very important.
Yeah, because that access to health, Tom, is really important, and that's definitely a concern around the whole state of Nevada and, well, the United States, but especially here, I know in Nye, that the access to health care it's a tough one. And
It is.
so, I can't say that we can fix all the problems, but we need to know what our community wants and perceives that is needed in this area.
You know, you've talked about so many things, and I think this assessment will also be something very crucial and very critical to our community. But, I always bring up things for veterans as well. And right there in your lobby, you have a place, if any veterans have any questions, they can come in and see a veteran service officer.
That's correct, Tom. We started that when I was here before,
Okay.
and very, very proud of that. Whatever we can do, we would like to do for our vets. They are deserving, and I think that brings up the brand new VA clinic that's right on our property,
Yes.
and I should say our campus, and that was so much needed. I have to tell this story though. Do you remember when they closed down the VA clinic here in town at
Yes,
one
I
time?
do. I remember
because
it
I
quite
think of
well.
mold. I
Yes.
think, I can't remember, but anyway, I
It was
remember.
mold.
Yep, I remember getting this phone call at Friday at like 3 o'clock, and they call, is there anything you can do? And it's like, hey, we'll figure out something. And it literally looked like, I mean, people referred to it as our MASH station downstairs.
Yes.
But we made it work.
It worked.
And it worked well. And what I will tell you, I still get comments on that was the best security that we ever had, Tom, because they provided security for us too, and it was a great team effort. So I just love that story because it was
fantastic. And for those of you who do not know about it, all the veterans were then going to the hospital, and they set up offices for the doctors in the trailer across the parking lot, and we were also in the basement. Hey, that was what it was all about. That was the veteran hospital for a while.
But we worked together as a team, and that
Yes.
was really important. Yes.
And even though we have the new clinic, like you say, it's on your campus, we're still working together.
We are.
What are some of the other things that you're doing for veterans at the hospital?
Well, some of the services that they've been able to come over and get, which is very handy for them because we're on the same campus, is their lab tests and their imaging tests, X-ray, radiology type testing. And so we're working very closely with a couple of the offices to see what other specialty services that we could provide for our vets, Tom, because I think I go back to the same thing. I have a 91-year-old father and an 86-year-old mother. I don't want them traveling. And so again, it's really, what can we do? And every time somebody goes out of town, we know the economic impact to our town too, because they're taking, there's not only different services, but their money's out of town, and we like to keep it here in Pahrump.
And anytime a veteran has to travel over to Las Vegas for any service, because we can't do it at the VA clinic. And so if those services can be done right at Desert View, it keeps us here, it lets us stay home, and it still gets the job done.
It's a win-win for everyone.
Absolutely. Okay.
Yeah.
Tell us more about not only the assessment, tell us more about what you hope to accomplish with that, and anything else that you're doing that the community needs to know about.
The accomplishments that we want to get out of this survey, again, Tom, we can't survive without the patients here in Pahrump supporting us. So again, it's so important for us to hear from our community and find out what our community wants from Desert View Hospital. And like I say, it doesn't have to be services, it can be education, whatever it might be, that's what we need to know. And our accomplishment is to get what are the top 5 items actually our community wants out, from us. And that is truly important. Again, we have to put our action plans in place. It doesn't get to just sit in the closet if somebody, because it's important. That's what happens to some of these surveys and different things.
That's true.
But we're committed to our community, and we want to make Desert View a better place, and we will. And so, again, some of the different services right now, we're going to concentrate on bringing on orthopedics, and that's our main focus right now, because we know that is a lack of service here in town. We're still trying to work very closely with healthcare partners and Southwest Medical to get some of the services that, the specialties that they have brought over to the hospital, so we can have, again, what's best for our patient. And that's really, really important. So as far as the expansion, I believe that I'm going to say that's more like in 2018, maybe even to 19. We know that takes a long time, but some of the services we will be bringing on. We will be bringing on a specialty unit within the hospital. It's going to be more like an ICU unit, 2 of them. That means that we can take care of the more critical patients. So again, they don't have to be shipped out. And we should have that in place at probably about the end of April, where waiting for a couple more pieces of equipment, and that's going to be a real positive to our hospital too.
So we can say to our community, if you have any questions or concerns, now at least we know what the plans are. So if you want more update on it, if you missed something that Susan has covered, be sure to go ahead and call her or call Mandrell at this number and let them know, look, I just have a question about this, or I'd like to make a positive comment about that, or I just have a question, and you want to get clarification. You know, when we look at this, and we talked in the first session about maybe if you have any concerns, you can always call and find out. They do have I'm going to call it a patient advocate. Mm-hmm. So they have a person you can talk to, and we're always going to drop everything on Mandrell first. You contact her, and she'll put you in the right direction to let you know who you need to talk to if you have a problem or a concern to get it resolved.
Very true. Again, it goes back to if we don't know about it, we can't fix it.
Absolutely.
So
it's your hospital. You want to make it the best for our community, and the only way to do that is to let them know what you need.
That's so true. So again, participate in the community assessment. Let us know, and any concerns, get a hold of Mandrell at the number shown on the screen. We want to know. And we have a lot of changes going on at the hospital. We are going to be changing radiologists group.
Okay.
We're going to be changing our emergency room physicians group again. So there's a lot of changes, but good changes. We changed our hospitalist group. So again, just lots of changes, but they're for the positive. They really, really are. But with those changes, Tom, I also want to say that's when people might perceive that, you know, that they didn't get good care, whatever it might be.
Okay.
But let us know. Please let us know, community, because we do want to deliver good quality care, and we need to know if it's perceived or you did not get that from us.
You know, I have to say that when I've had service at the Desert View Hospital, I've always had outstanding service, and I've been very pleased with it. And some people say, well, that's the way they treat you, but they don't treat us that way. I think they treat everybody the same, and they're trying to do the very best they can for
Yep.
the patients.
Yep.
So give them the chance.
Yep. Thank you, Tom. Thank you.
Okay. Always, for everything that you do, remember, you've got the phone number. You know who to contact if you have any questions or concerns. And we definitely want to thank Susan for coming in today to share all this information with us about Desert View Hospital, the growing pains, all the things that are happening. So Susan, we
Thank
really
you.
want to thank you for coming back and joining our community again, because we missed you.
I miss the community. Thank you.
Okay, look, we're going to be back shortly. Thank you.